Tizanidine Hcl is a medication used to treat muscle spasms caused by certain conditions such as multiple sclerosis or spinal cord injury. It works by helping to relax the muscles. The usual starting dose is 2 mg taken every 6 to 8 hours, but it can be increased as needed to a maximum of 36 mg per day. It is best to take Tizanidine Hcl at the same times each day and can be taken with or without food. This medication is taken by mouth as directed by your doctor, usually every 6 to 8 hours. The dosage is based on your medical condition, response to treatment, and other medications you may be taking. Be sure to tell your doctor and pharmacist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. To reduce your risk of side effects, your doctor may direct you to start this medication at a low dose and gradually increase your dose. Follow your doctor's instructions carefully. Do not take more than 36 mg a day or more than 3 doses in a 24-hour period. Your body will absorb this medication differently depending on whether you take it as a tablet or capsule, whether you take it with food or on an empty stomach, or if you sprinkle the contents of the capsule on food. Be sure to discuss with your doctor how to take this medication to determine the best way to take your dose, especially when changes to your dose are being considered or if your doctor prescribes a different form of tizanidine, such as a tablet or capsule. If you suddenly stop using this medication, you may have withdrawal symptoms such as anxiety, tremor, increased blood pressure, heart rate, or muscle tenseness. To help prevent withdrawal, your doctor may lower your dose slowly. Withdrawal is more likely if you have used tizanidine for a long time or in high doses. Tell your doctor or pharmacist right away if you have withdrawal. Tell your doctor if your condition does not improve or if it worsens. Common side effects of Tizanidine Hcl may include dry mouth, drowsiness, dizziness, lightheadedness, constipation, weakness, and tiredness. If any of these effects persist or worsen, notify your doctor or pharmacist. To alleviate dry mouth, you can suck on sugarless hard candy or ice chips, chew sugarless gum, drink water, or use a saliva substitute. To reduce the risk of dizziness and lightheadedness, be sure to get up slowly when rising from a sitting or lying position. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefit to you outweighs the risk of potential side effects. Many people using this medication do not experience serious side effects. However, it's crucial to inform your doctor immediately if you experience any serious side effects, such as fainting, mental/mood changes, slow/irregular heartbeat, or changes in vision. In rare cases, tizanidine has been associated with very serious, and rarely fatal, liver disease. If you develop symptoms of liver disease, such as persistent nausea/vomiting, severe stomach/abdominal pain, dark urine, or yellowing of the eyes/skin, it's important to seek medical attention right away. Though rare, a serious allergic reaction to this drug is possible. Seek immediate medical help if you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice any other effects not listed above, it's important to contact your doctor or pharmacist. If you experience any side effects, you can also report them to the appropriate medical authorities in the US or Canada. Before taking tizanidine, make sure to let your doctor or pharmacist know if you have any allergies or if you are allergic to it. Also, talk to your pharmacist about any inactive ingredients in the product that may cause allergic reactions or other problems. Before using this medication, inform your doctor or pharmacist about your medical history, especially if you have low blood pressure, kidney disease, or liver disease. This medication may cause dizziness or drowsiness. Avoid driving, using machinery, or any activities that require alertness until you can do them safely. It is also important to avoid alcoholic beverages and to talk to your doctor if you are using marijuana, cannabis. If you are planning to have surgery, it is important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of this drug, especially dizziness and drowsiness, which can increase the risk of falling. If you are pregnant, this medication should only be used when clearly needed. Be sure to discuss the risks and benefits with your doctor. It is also important to consult your doctor before breastfeeding as it is unknown if this drug passes into breast milk. When taking Tizanidine Hcl, it's important to be aware of potential drug interactions. Certain medications, such as those used to treat high blood pressure and some antibiotics, may interact with tizanidine and affect how it works in your body. It's important to keep a list of all the products you use and share it with your doctor and pharmacist to avoid any potential interactions. Additionally, be cautious of using other products that may cause drowsiness, such as alcohol, marijuana, antihistamines, and other muscle relaxants, as they can intensify the drowsiness side effect of tizanidine. Always check the labels on your medicines and ask your pharmacist about using them safely. If you or someone else has taken too much Tizanidine Hcl and is experiencing severe symptoms like passing out or difficulty breathing, it is important to seek immediate medical help. In the U.S., you can call the local Poison Control Center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of an overdose may include severe dizziness or drowsiness, confusion, slow or shallow breathing, and fainting. It's important not to share Tizanidine Hcl with others. Your doctor may also want to monitor your blood pressure and liver function while you're taking this medication, so make sure to keep all your medical and lab appointments. Be sure to consult your doctor for more details on how to take this medication. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. It's important to store Tizanidine Hcl at room temperature, away from light and moisture. Keep it in a safe place, away from children and pets. When it's expired or no longer needed, make sure to properly discard the product. You can consult your pharmacist or local waste disposal company for guidance on how to do this. And remember, do not flush this medication down the toilet or pour it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.